After years and years of promising to come up with a health care plan, the president is out today with broad strokes, at least, of a proposal. He's calling it the Great Health Care Plan, and it aims to lower drug prices and premiums and would require insurance companies to write in quote-unquote plain English and be transparent about their prices. All right, News Center tonight, we'll talk about this. Reese Colbert is here. Reese, the host of the Reese Colbert Show on SiriusXM, and Rob Bluey is here. Rob, the executive editor at the Daily Signal. So, Rob, I don't know if I'm willing to say this is the Republican plan. Say, hey, where's your plan? Repeal and replace. But to the point, it's a kind of an outline, and now I guess you got to work it through with Congress. What stands out to you about what the president has presented?
Well, Connell, first and foremost, we always knew that it was going to be the president's decision and the president's decision only, not anybody in Congress, to set the agenda for health care. And so I think it's refreshing here to start the new year with a health care plan. Republicans still have the opportunity to use the budget reconciliation process, meaning that they don't necessarily need to get to that 60-vote number in the Senate to get this done. That is going to be significant. That's how they passed this one big, beautiful bill. And then in terms of the details, I like the fact that he focuses on putting more choice in front of consumers, exposing the cost of healthcare by really putting an insistence on transparency, and ultimately reducing some of the middlemen, like insurance companies, that are profiting.
Right. I understand that. Again, I'm not saying that this is detailed. That's not the argument, Reese. We're saying that the broad strokes are out, at least finally, from the Republican side on something. And the criticism of Obamacare had been that, you know, it was giving away too much to the insurance companies. What would you say to that criticism, as the Republicans try to come in from the other side on that?
Well, Obamacare actually required that more of what the insurance companies received from consumers went to actual health care as opposed to profits and other non-health care services. And so what we're seeing from President Trump is a rerun of the same ideas in broad strokes. These are bullet points, not an actual plan, that haven't done anything to move the needle for the past 15 years or 16 years going on now that they've been trying to repeal it. And so this might be good branding, but it's something that we've seen before. And here's the thing. If anybody believes that Republicans who shut down the government or allow the government to be shut down to prevent people from getting subsidies are going to all of a sudden be willing to hand over a check to the American people as they're screeching about fraud to get direct payments as opposed to insurers, I have a bridge in Palm Springs to sell you.
Yeah, I know. Well, I get it. The bridge that goes where? Okay. That said, there's a couple of other things I want to talk to you about. I get to Machado in Venezuela in a moment, but first there's a Gallup poll out. This will surprise nobody, Rob, but the Gallup organization found that when they looked at ethics, the groups at the bottom are Congress and telemarketers. Those are the lowest ratings on ethics. So that kind of makes sense.
Well, it's one of those things that we see time and again. There's deep frustration with Congress, and yet it seems that the American people continue to send their own representative back to Washington. So
no,
it's
you're
this
right.
anomaly that we
always
often
win.
Times question as to what's going on exactly. But Connell, I'll say this. I think that Republicans, it should be a wake-up call that they need to focus on delivering on the promises that President Trump made to the American people. They also need to ensure that they are addressing some of the affordability issues that we've seen come up over the course of the past year. If they don't, a lot of them will be out of a job come November.
No, they will. And I could argue, Reese, that it's a wake-up call, or anything like this should be a wake-up call for Democrats. And the argument I would make is that if you're Democrats and you want to win, you got to win. It's not enough to say Trump's bad, and you have to have your own argument going into next year, whereas you're in that same group as well.